Hi everyone, my name is Andrew Stevenson and I'm a PhD candidate in geography at McGill University in Montreal. In this presentation, I'm going to introduce our work on creating new Canadian retail food access measures and discuss how I plan to use them to determine associations with diet and health. So, as we know, healthy diets are fundamental to population health. This paper, published last year in The Lancet, analyzed the health effects of dietary risk globally, and the authors found that dietary risks were responsible for 11 million non-communicable disease deaths worldwide. Suboptimal diets were responsible for more deaths and disability than any other risk factor globally, including tobacco smoke. Too much salt, too few whole grains, and not enough fruits were attributable to more than half of the diet-related deaths. So modifying the retail food environment may be an important way to create meaningful improvements in diet and health at the population level. One of the most commonly used conceptual frameworks of the food environment was developed by Glanz and colleagues in 2005, and it proposes that the community nutrition environment, outlined here in red, or the types and location of food outlets that operate in a given area, is an important part of the food environment that influence diet and health. So to start my PhD, I conducted a systematic review on the associations between access to neighborhood food outlets, diet, and body mass index. We found that there was moderate evidence of an association with BMI and inconclusive evidence of an association with diet, which is odd because that would be the presumed mechanism. We suspect that this might be due to the difficulty in accurately measuring diet. So there are some important gaps in the Canadian literature. First, there's no gold standard nationwide food outlet data set to create access measures. So most studies use proprietary data sets like DMTI Spatial or ZipCom, but these can have substantial error. The methodology behind how they're compiled is often unknown, and food environment measures that are created from these data sets cannot be shared openly because the underlying data is proprietary. Municipal health inspection lists have also been used, but they contain varying amounts of error. They're specific to a local municipality or region. They may not be updated frequently, and they can be difficult to acquire. Another important gap is that diet is notoriously difficult to measure. So diet quality ascertained through self-reports has substantial bias, including recall bias and social desirability bias. And there's just large variability in day-to-day diet. So the implications of this in association studies can be inconclusive and unexpected findings. Another gap is that BMI is mostly ascertained through this can bias results towards the null. However, it's likely a more objective measure than diet, even when self-reported, because it does not vary greatly day to day, and it's relatively easy to understand. And other markers of cardiometabolic health are understudied in Canada. So I've been working with my colleagues and as part of my PhD project to create an accessible and accurate food environment data set that will serve the public health and research community. We've been able to access the Statistics Canada Business Register, which is a full repository of businesses in Canada that hasn't been used for this type of research before. So it's likely more complete and accurate than other data sets because businesses are identified from mandatory tax data collected by the Canada Revenue Agency. It facilitates accurate categorization of food outlets because establishments are consistently coded with the most up-to-date industrial classification codes, which are NAICS codes, and there's ongoing quality evaluation done by staff members at StatCan to try and ensure high data quality. And because this is kind of a pilot project for StatCan, we've actually had to access the microdata at the StatCan headquarters in Ottawa, which is about a 2-hour train ride from Montreal. Once we got access to the data set, we were able to categorize the businesses into food outlet constructs. This slide shows an example of how the outlets were categorized. So first we start with the master file of food outlets, and then we pulled outlets from the file based on their NAICS code. And again, NAICS codes indicate the primary business function. Once outlets were pulled from the master file, we cleaned and checked them by looking for keywords that alluded to another category, by filtering through the operating names in English and French, and by identifying duplicates. Once they were cleaned, the outlets were put into their final food environment categories, and any that were flagged as not belonging to that category were reclassified or removed. So we created 19 food outlet categories in total. To create our actual food access measures, we first had to decide how to represent a neighborhood. We decided to use 1,000 meter and 3,000 meter network buffers around the population weighted centroid of every dissemination area in Canada. And dissemination areas are the smallest level of geography that census data is shared, and they contain about 400 to 700 people. The 1,000 meter network buffer represents a 10 to 15 minute walking distance, and we think that the 3,000 meter buffer may be more appropriate for people who drive and for more suburban and rural areas. Once the buffers were created, the categorized food outlets were imported into ArcGIS and then joined within the buffer. Then the final food access measures were calculated. So we created 19 absolute density measures and 2 relative densities, but the measures can be combined in many different ways. To give an illustration of how these measures can be used, I aggregated the neighborhood level measures across major cities in Canada to calculate the city level modified retail food environment index score, and this is the proportion of healthier outlets. The mean across the cities was 21.7, with a fairly wide variation between the cities. So the highest was Vancouver at 43, and the lowest was Halifax at around 13. So I actually calculated these scores for 35 cities across Canada, but I'm not able to access the data right now due to the COVID-19 situation, so I wasn't able to share those in this presentation, unfortunately. To test how these measures compare to the same measures derived using commonly used proprietary dataset, DMTI, I performed a basic correlation test. So the y-axis here is the measures that are at the city level derived from DMTI spatial, and the x-axis are the measures derived from the business register. The 45-degree line represents perfect correlation, and each dot represents a different city, with the size of the dot representing the population size. So the R value here shows a very strong correlation, which is a good thing, because it shows that the two data sets are measuring the same thing or the same concept. However, even though the correlation is strong, the rank order of the cities changes depending on which data set was used to create the measures. So we have the StatCan Business Register versus DMTI. And using DMTI, cities like Quebec City, Saskatoon, and Hamilton drop a few spots, and Edmonton actually jumps 5 spots. So it does make a difference on which data set is being used. So I then plan to use the neighborhood level food access measures to determine associations with diet and diet-related health outcomes at the individual level, with data that comes from 2 large national health surveys. The first is the Canadian Health Measures Survey, and outcomes I'm interested in looking at are measured BMI, blood pressure, hemoglobin A1Cs, and cholesterol ratios. The second is the 2015 Canadian Community Health Survey Nutrition, which has a 24-hour dietary recall component, and I'd like to look at fruit and vegetable intake, sodium, fat, and total energy intake, as well as food security. The advantages of the Canadian Community Health Survey is the use of the 24-hour dietary recall with the automated multiple pass method. So many people think that the 24-hour dietary recall is the best self-report tool we have, and the automated multiple pass method is designed to help people remember all the food that they consumed. The advantages of the Canadian Health Measure Survey is that they use measured height and weight and measured markers of cardiometabolic health. So people actually went to these mobile clinics that were stationed around the country to get their blood drawn and other measures taken. Finally, both surveys have a large sample of Canadians in diverse geographic settings. So the previous slides covered how I'm going to use these measures for my PhD thesis, but a product that is going to come out of this work is the Canadian Food Environment Dataset, or CanFED. So this will provide Canada-wide national measures of the food environment at the neighborhood level, which will be accessible to the research and public health community. And for this dataset, there will be a researcher version and a general use version. So the researcher dataset will need to be accessed in secure Stat Canada sites because it contains more sensitive information, which is more detailed as well. And the general use dataset can be shared outside because it's a little bit more sterilized and we've collapsed some of the categories. So the several food outlet categories that we created allows for flexibility in characterizing the food environment, and so that researchers can address a wide variety of questions. And again, the data comes from the Business Register, which is a high-quality data set of businesses that may improve exposure ascertainment. Overall, we hope that these measures prove useful to the public health communities in Canada who might want to create and monitor food environment interventions and facilitate data linkage with health surveys, administrative data, and investigator-led cohort studies. So I'd like to thank all my collaborators and the folks at StatCan who actually gave us access to this data. And if you have any questions, I'd be happy to answer them.